Welcome to the ZenBeat Tech series of podcasts. Today we will speak about cybersecurity in healthcare with Rafael Reis. Uh, Rafael has 12 years of experience in engineering, cybersecurity, and researching. He is technology manager at Mehmet. It is healthcare digital company. Also, Rafael is independent security researcher. So the topics of the podcast will be about the importance of cybersecurity in healthcare organizations, also types of cyber attacks and their examples, and errors leading to hacks and how to avoid them. So welcome, Rafael.
Thank you for the introduction. Yeah, as you said, my name is Rafael Reis. I am from Brazil. I am 20 years old. And as you said, I have around 12 years of experience in technology and a little bit uh, in cybersecurity as well. So it's a pleasure to be here. You have me here. I appreciated the invite. Okay. And by curiosity, it's the first time I'm talking public like this.
Yeah. So we can start with questions.
Yeah.
Why did you start doing cybersecurity?
Well, I started doing cybersecurity by curiosity, As a young guy, when I was like 17 years old, I started hearing about cybersecurity, stuff that you can do, uh, how to protect against attacks and stuff like that. And it was interesting for me. And so I had the pleasure to meet a guy. His name is Daniel Donda. He is the MVP from Microsoft for some consecutive years. And at that time, we hired him to be a consultant at the company I was working at the time. And then I realized that this job is nice. The thing that he could do at the time was incredible. So I asked him, well, how can I start studying this thing, without even paying for a course or something like that. And he advised me to research on Google about specific topics. And so I started that way.
Thank you for sharing your story. The next topic is the importance of cybersecurity in healthcare organizations. Why does cybersecurity matter in healthcare organizations?
Well, I can say that we are dealing with a super important information. Okay, like we're dealing with persons. We are dealing with how can I say the kind of information that is super sensible for persons that can touch in its emotional, that can touch in its personality. So we have to care about it because it's not a normal information that today we change. For example, if I have AIDS, that's not the case, but let's say that, and some hackers have this information, they can do a lot of damage to me. You know, like they can extort me, they can expose me. Imagine and if I have AIDS and I am a super famous people person,
Mhm.
it's much, much damage.
Okay. Do you have any stories related to cyber attacks in healthcare organizations? Maybe like example will be WannaCry. Also, how it's happened
Yeah.
in Brazil, maybe.
Okay. Well, some years ago, I think 2021, we here in Brazil, there's a group called Fury, a group of healthcare and hospitals, and this group suffered some ransomware attack. I don't know if it was WannaCry. I didn't remember, but they stayed like 3 for 1 week without running your business. So um, imagine a hospital that cannot run your day-to-day work. It's super damage to the people that need healthcare.
So I think that's why like healthcare organizations are in danger because of the lack of the cybersecurity.
Yeah, I think mostly yes, because like imagine a guy that has allergy for some drug, and he's suffering some special condition attack. And at that moment, the doctor and his staff cannot know which medicine or which drugs he has allergy with.
Mhm.
So it's it's dangerous, the people that that need this healthcare uh, maybe will suffer some damage about your life because of softwares or systems that is running independence of its doctor or you know
Um, what is the impact of cyber attacks on hospitals? I think they are like taking our data. How they
well yeah.
use it?
Okay, well there's a lot of tech involved to hospitals and healthcare organizations and also devices of of medicine. And hackers can do a lot of things around those subjects. For example, this example that we talked about earlier. They encrypt all the data that is related to allergies and conditions and stuff like that.
Mhm.
Um, they can like exhort the company to decrypt this data, uh, like by asking money back. They can like expose this data. They also can like if some device is hacked, that I think would be a question you would ask to me. Imagine it and instantly boom, be hacked.
Mhm.
If it stopped to work, the guy that needs this medicine maybe will die. And I think it's stuff like that hackers can do against healthcare organization.
Mhm. So I think that's why healthcare organizations should try to prepare it against cyber attacks. So how dangerous is it to not to be prepared for cyber attacks? And will it be possible to recover data that was attacked if it's already happened?
Okay, well, yeah, for sure, it's important to be prepared for any kind of attacks. Um, if you're not, you will be maybe like have your customers to think about your company is reliable. You know, it's one thing. Another thing is that you lost your data. You know, because if you don't have the encryption key and it's encryption operating, you will lose your data if you don't have backups.
Mm.
You know, Uh, and I think there's most of that.
So that's why healthcare organizations should have like backups to recover the data if they will be attacked. Yeah.
Yeah, backup is the first thing, but at least backups.
Mhm.
But I think healthcare organizations and other kind of organization have to be prepared for those attacks in, in a better level, not just backups.
What do you think? Do medical devices need cybersecurity?
Sure, sure. As I said, imagine an insulin pump that stopped to work. Um, the consumer will die, and other kind of devices as well. The ring of the heart. And other kind of devices.
Um, what are the most common mistakes in cybersecurity in healthcare organizations?
Well, I would say that the common mistake is to think that healthcare organization is the same as a normal organization. As I said in the beginning, we are dealing with personal data, personal conditions, and emotional of people and stuff like that. So it's like a bank. You have to be much more prepared for an attack than a normal organization. I'm not talking that normal organizations shouldn't have security team and stuff like that, but I'm talking that it's different.
Mhm. Um, I think like most of the mistakes in cybersecurity in healthcare organizations are from human guilt. Is it right?
Yeah, human guilt is one of them. There are others, but yeah, healthcare organizations you have to prepare the employees
Mhm.
for those kind of phishing attacks. You know, like an email that you open, uh, a document that you share, and a little bit more stuff about phishing. You know?
Mhm.
So yeah, human guilt is one of them, but there are much more. You know?
I think like doctors have no time for cybersecurity. Maybe we can do uh, some webinars or something for doctors. Or what do you think about cyber hygiene
Okay, well,
for doctors?
about
Maybe.
cyber hygiene, I've never hear about this term, you know, but I can like make a comparison with the personal hygiene. So it's the same. You have to do the job,
Mhm.
like protect your password with a uh, strong password, like change it eventually. Uh, use numbers, characters, special characters, make backups. And also, as I said, doctors don't have much time to learn about security, and also employees of companies like an attendant or a market guy or people like that. But they're like webinars, yes. Um, they're like articles that we can like put in some uh, some sites about medicine, um, and also there's some programs that like for example in the net we will run this beginning of this year. That is like an education program for to be prepared
Mhm.
against attacks. You know, and for example, it's like a game that a company is supposed to send emails with virus and stuff like that. It do not affect your environment, but it's like a game that you have to think about uh, open an email before so stuff like that.
I think it's cool that Mehmet is prepared for cyber attacks. I think it's like it's really good that Mehmet has education program. So it is it a, you said it's game, yeah?
Yeah, it's like a game. Like I can say, for example, Racker Rangers
Uh-huh.
is one of them. You can like hire those people to run this program in your organization. Not only in healthcare organization, it can be run in kind of organization.
Mhm.
But yeah, we will run this program. We already ran it. It's before, and we will do this year as well because we are growing. Some investors put money in this organization. We are hiring a lot, so we are growing, and we need to run again this program to prepare all our employees to those kind of situations. You know. Okay, well, I would say that first of all, you have to respect the rules of privacy of your country. You know, because uh, it's super important. And then I would say the basic, like make backups, have strong passwords, change it frequently, uh, have, if possible, have a security team. And well, I think that's it.
Mhm. If the majority of cyber attacks are due to human guilt, which can happen to anyone, is there any way to protect yourself from the technical side?
Yes. Well, first of all, update your software.
Mhm.
Yeah. Uh, have have the software updated is important because right now I think there are researchers. So uh, have the software up to date is one of the important things. Because, for example, right now I think maybe there are a lot of researchers, maybe black hats, looking to public vulnerabilities in those old version softwares. So they can know if you are running an old version, and if you are running an old version that has vulnerability, they will have an exploit for that because it's proven. So first of all, teach yourself.
Mhm. Yeah, I think I'm done with questions. Thank you, Rafael, for coming to our podcast. Um, so I wish you good luck and goodbye to all guests for our podcast too. So
Thank you. I appreciate. It was fun.